Well, thank you, April. Thank you, Alicia. I have been in LifeWave, let's see, it'll be 2 years come January. And like April said, I am a massage therapist, and I had one of my clients, Jamie Hyatt, on my table, and she started telling me about this light technology and how wonderful it was. And she had just started using the patches in December. Well, I had at the moment been using a red light therapy to help heal some tissue. And so when she said light therapy, I knew right away what that was and what light therapy can do. So I had a little issue going on at the time, and that was another reason that that really rang a bell with me. As a massage therapist, you use your hands, and I had developed a hand tremor. And so my left hand would do a little bit of a shake. And so I was very conscious of that. And so when I would go to touch my client, I would immediately apply pressure with that hand so they could not feel the shake. And I was looking at probably having to retire because of that. But I started using the patches and researched which ones, were good for possible brain health. I had not been to a doctor about the tremor, so I started using the X39 and the Eon and the Carnosine. And within a month, that tremor was gone. And I was so sold on the patches and just started telling everybody about them. And like you say, April, it just changes your life. And now my dog story is another whole different issue. We have a golden doodle, and I don't know if any of you are familiar with that breed, but it is the sweetest dog you will ever meet. They have the best dispositions, and so I had there she is. And so she is such a big part of our family. She will be 15 years old in December. And she has always run with our grandchildren and just, so easygoing and easy to take anywhere you go. But she started kind of showing her age this spring. She started just kind of laying around and sleeping more and not eating as well. And we just thought, oh, she's really starting to age, and we hated to see that. Then in May, she started getting really sick, and she started throwing up every morning. And then by later in the day, she'd get a little bit better. Well, the third day of this, we called the vet. And, just for those of you, I don't want you to think we let her go 3 days, but we live in the woods. And part of living in the woods and with deer, dogs will eat deer poop. And so that's one of those things that can make dogs ill. And so that's kind of what we initially thought was going on with her. And then when she didn't get any better, we went to the vet and we said, we think she's gotten into something. And so we wanted to have some blood work done or whatever. So they did. And her liver enzymes and her kidney functions, those numbers were very, very high. And not being a medical person, I can't tell you which one she highlighted for me, but she said one of them should have been like around 64 and it was 1200.
Oh,
My goodness.
Yeah, so she said that with numbers like that and the age of Chloe, odds are she has a tumor of some kind. So they wanted to do an ultrasound, and they did. And she had a large mass that was on her kidney, and it was touching the liver as well. And that's what was causing her to feel so ill. And because she was throwing up like bile. Well, we had planned to go on vacation in 2 weeks. And the vet had said, this is not operable, the size of the tumor and the age that she is. So, we were just devastated and we did not want to go on vacation and leave her. And our vet is also a good friend of ours. And she said, Diane, go on vacation with your family. She said, we'll keep her here at the hospital. And that way, there'll be somebody always checking on her. And she said, I don't think she's to the point where she's going to pass away in a couple of weeks. And so we did. Instead of going for a week, we went for 3 days. And she stayed at the hospital with the vet. And then when we picked her up and took her home that very next morning, oh, she threw up, and she was so sick. And I just felt so sorry for her. And so I thought, I need to patch her. I had patched her before with, like you take your patch off and you can put it on your animal. And I had done that, but not like every day. I'd done it off and on. But I thought this dog is so sick, she needs a fresh patch. And so I started patching her. And from the first day that I patched her, she never threw up again. And so we would put an X39 on her every night. We didn't do it during the day because I thought she'll be active and it'll end up off of her. So we put it on her in the evening and leave it 12 hours, like from 8 to 8. Um, and she just kept getting better. And she started doing things we had not seen her do in years. She started getting where she hadn't really talked to us much anymore. She used to come and kind of woof at you, and she wanted to go outside, and she hadn't done that. And so she got where she would come to us and want to go outside, and she wanted to run up and down our driveway, is what she wanted to do. And not at all like a 15-year-old dog. And then she got where we would go to feed her in the morning and she would follow you to the kitchen and want that food, just right now. She was just ready to eat. She had not done that in years. So many things about her were going back to being like a puppy. And so I thought, well, this all started with the patches about the middle of June. So I thought I'm going to wait till about the middle or the end of September, give it 3 full months, and then I want to go back to the vet because we knew she had improved. And we were hoping that numbers were better and that maybe this tumor had shrunk a little. So last Thursday, I took her to the vet and they did some blood work on her. And then they did another ultrasound. And when the vet came back in, she said to us, she said, well, her numbers are down a little. She said one of them was down like 100 points and the others were down maybe 60, 70 points. But she said they're coming down. And she said, that's a good sign. Now, she said, as far as the tumor goes, she said, Diane, I looked and looked and I couldn't find it. So, 3 months, and she could not find that tumor on the ultrasound. And Becky said, I have no explanation for this, Diane. And I said, but I do. And so she knew about the patches, and I had given her some info, and she just nodded her head and said, yes, I think you're right, because there's nothing else that has changed in this dog's life besides the fact that we had started patching her. So,
That's
and
Oh
our
my goodness. And it was just X39, Diane?
just X39. That's the only patch I've been using, and I'm going to keep patching her.
oh yeah.
Yeah. So,
That is just tremendous. I know a lot of people have joined in since Diane started her story, but she was sharing it first with us. We'll just wrap that up too. Is Diane had she's a massage therapist and she had developed a tremor in one of her hands, right, Diane, and just in one hand.
yeah.
And she had started using the patches. I think you said X39EM carnosine. Was there
Yeah.
another?
No, that was the three main ones that I started with.
And she started using those, and her tremor went away. And how long?
It was about a month, and it was completely gone, and it's never come back. I'm still
Wow.
wearing patches.
That is so wonderful. And then your other wonderful patch story was of your dog Chloe with a tumor and had been really sick, and she'd been dealing with the health issues with the dog for months. And now and so when people are asking too, Diane, where did you put the X39 on Chloe?
Okay, if you know golden doodles, they are fuzzy. And so we just took right at the back of her head because we didn't want it to be at a place where she could get it off.
Okay.
And we just took scissors and cut some hair off right there and just put it down. It doesn't have to be, flat on skin. With animals, they seem to do just fine. If there is some hair in the way, they're fine. I mean, she's a perfect example. We never shaved it off. We just cut a little place where it wasn't quite so long. And that worked fine. And she would leave it on all night. She'd leave it on till we took it off. So
That is perfect. That is such a wonderful. Thank you so much for sharing that. That's really powerful story from our fur babies, your sweet baby, and yourself as well. Just two major transformations. Alicia, did you see any other questions in the chat for Diane?
She did ask, someone asked, where did Diane patch with the X39 for her tremors?
Oh, good question.
okay. Oh, that's a great one. I did patch my X39, of course, on the back, and I would put my Eon back there as well, because I'm thinking brain. And so I'm thinking I want it headwise. And I would put my X39 right here on the side of my temple. It was bothering, my left hand. And so I just went that way, put it on that side. So
And you wore it in the daytime or at
no,
night? When did you wear it?
I would wear the X39 and the Eon during the day, and I would wear the carnosine at night.
Okay, very good. Nice.
Carnosine.